I rise today, Mr. Speaker, in support of H.R. 4631, the Autism Collaboration, Accountability, Research, Education, and Support, the CARES Act of 2014, introduced by Congressman Chris Smith of New Jersey. Autism Cares demonstrates our continued effort to address the needs of children and adults with autism spectrum disorder, ASD. Thanks to the monitoring done by the Centers for Disease Control and Prevention, the CDC, we know that as many as 1 in 68 children have ASD. With recent studies showing that ASD can be detected in the first 6 months of life, the screening and diagnosis funded in the bill will mean early diagnosis and improved health and behavioral outcomes. Many of these children are now transitioning into adulthood and will need community-based services to replace those provided by the schools. As a part of this bill, HHS will be required to study their needs and available services to identify gaps and make their transition seamless and productive. The bill would also fund important research at the National Institutes of Health to understand and treat ASD and the operation of the Interagency Autism Coordinating Committee. I urge my colleagues to support this important legislation and reserve the balance of my time.
The gentleman from Texas.
Mr. Speaker, I yield myself as much time as I may consume.
The gentleman is recognized.
Mr. Speaker, I rise in support of H.R. 4631, the Autism Collaboration, Accountability, Research, Education, and Support Act of 2014. Autism spectrum disorder, or ASD, is a developmental disability that can lead to significant social, communication, and behavioral challenges. We still do not know all the causes of autism, and we do not have a cure, but we know that early intervention services can improve a child's development. Recent data from the Centers for Disease Control and Prevention show more children than ever before are receiving autism diagnosis. This is due, at least in part, in a broader definition of ASD and better diagnosis, but we cannot rule out the possibility of a true increase in the number of Americans with ASD. Continued federal support for autism activities at HHS will help us learn more about the causes of autism, and it will help more children receive early diagnosis and intervention, as well as access to services that they need throughout their lives. I want to acknowledge the sponsor of the legislation, Congressman Smith, Congressman Doyle, and the sponsor of the Senate companion legislation, Senators Menendez and Enzi, and leaders on the Energy and Commerce Committee, on the Senate Health, Education, Labor, and Pensions Committee for making it possible to have a consensus bill before the House today. I urge my colleagues to join me in supporting this bill so we can send it to the Senate and on to the President for his signature well in advance of the September 30th sunset provision in current law. Mr. Speaker, I reserve the balance of my time.
The gentleman reserves the balance of his time. The gentleman from Pennsylvania.
Mr. Speaker, at this time, I would like to yield 5 minutes to the distinguished prime sponsor of the legislation, man who has really provided the leadership on this issue, Congressman Chris Smith.
The gentleman is recognized for 5 minutes.
I thank my good friend Chairman Pitts for yielding and thank him for his strong support, along with Chairman Fred Upton, former Chairman Henry Waxman, and so many others, Mike Doyle, my good friend and colleague, who together we've, since 2000, headed up the Coalition for Autism Research and Education. We've done everything bipartisan. We have 91 members in the coalition right now. And I would also like to thank the staff who have helped us move this bill and negotiate text, including Gary Andre, Cheryl Yeager, Brandon Destro, Jean Rohrenbeck, Katie Navaria, Kate Benedetti, and of course Neil Bradley, and so many others who have been so critical to this legislation. Mr. Speaker, previous autism law, including the Combating Autism Act of 2011, made critical investments continued by this bill that are working to determine the causes of autism spectrum disorder, identify autistic children as early as possible to begin treatment, raise critical awareness, and develop new therapies and effective services. The latest prevalence data from the Centers for Disease Control and Prevention, Mr. Speaker, is shocking. 1 in every 68 American children are on the autism spectrum, a tenfold increase over the last 40 years. Boys on the spectrum outnumber girls 5 to 1. In my home state of New Jersey, one in every 45 children has ASD, the highest rate in the CDC study. I would note parenthetically, Mr. Speaker, I've chaired 2 congressional hearings on global autism, and this developmental disability is everywhere. One conservative estimate, 67 million worldwide. Looking back, Mr. Speaker, it was 2 dedicated parents from New Jersey who helped launch the comprehensive federal policy we seek to reauthorize today. Almost 17 years ago, September 1997, Bobby and Billy Gallagher of Brick, New Jersey, and parents of 2 small autistic children, walked into my Ocean County office looking for help. They believed Brick had a disproportionate number of students with autism and wanted action, especially for their son, Austin and Elena. So I invited CDC and other federal agencies to Brick for an investigation, only to learn that prevalence rates were high not only in Brick, but in nearby communities as well. Believing we had a serious spike in prevalence, I introduced the Assure Act, and that was contained or incorporated as Title I of the Children's Health Act of 2000. Mr. Speaker, much progress has been made since. Today, the evidence suggests there is no single cause of autism or type. Genetic risk coupled with environmental factors, including advanced parental age, low birth weight, and prematurity, among other factors, may be triggers. Signs of autism in a child usually manifest between 12 to 18 months, some as early as 6 months, while some regress after the age of 2. Yet transformative early intervention continues to lag. According to IACT, the clinical reality is that currently only about 20% of children with ASD are being identified early by 3 years of age, and that, members of the House, is not good, and it's got to change. The research clearly shows that early diagnosis means early intervention and much better outcomes. The most recent IACT strategic plan, and I encourage members to read it. It is a textbook on how the federal government should do anything when it deals with research. They have pointed out that during the past few years, there has been a major revolution in ASD genetics research. Research on potential relationship between immune system and ASD has grown considerably, resulting in, quote, major breakthroughs. Much progress, they go on to say, in understanding the prevalence and biology of conditions that commonly co-occur, including epilepsy, sleep disorders, GI disturbances, attention deficit hyperactivity, and psychiatric comorbidities. They also point out, and this is their words, particularly intriguing are the results of prenatal vitamin intake through supplements and diet, showing a 40% reduction in risk of ASD with prenatal vitamin supplements taken in the 3 months before or during the first month of pregnancy. Daily folic acid is also highly recommended. Mr. Speaker, there is another issue that this bill seeks to address. Every year, 50,000 young people on the autism spectrum matriculate to adulthood and are in the process of losing services. Jonathan Crotchman, a 16-year-old with Asperger's from New Jersey, was the keynote speaker at a Dare to Dream conference at Mercer County Community College last year. And he stated, and I quote, "I know I can be a great contributor to society when I graduate. However, I need continuing support to get there. Here is a fast fact."
Time has expired.
Whatever you got.
Yield an additional minute.
Thank you.
The gentleman has an additional minute.
Mr. Crotchman also said, here is a fast fact. If you take your high school diploma at age 18, you automatically lose services from your school district. Both individuals with autism and, like Jonathan and their parents, find themselves confronted with almost unimaginable challenges, including loss of school, housing, and then they have job needs. We are in the midst of a huge, largely invisible crisis that begs serious focus and remedies. The Autism Cares Act tasks multiple federal agencies to comprehensively study and report back to Congress on the special needs of autistic young adults, transitioning youth. Additionally, Chairman Upton and Chairman Pitts are in the process of requesting a comprehensive aging out GAO audit, which will include key stakeholder involvement. Passage of this bill, Mr. Speaker, is an important investment in a very, very important and special group of people who, along with their families, caregivers, and friends, face seemingly endless challenges and struggles. I strongly support members to support the legislation and yield back.
The gentleman from Texas is recognized.
Mr. Speaker, I yield to my good friend and colleague, Congressman Doyle, time that he may consume.
The gentleman is recognized.
Thank you. Thank you, Mr. Green, for yielding and for your support of the Autism Cares Act. First off, I want to thank my good friend and Autism Caucus co-chair, Chris Smith, for his leadership and work on this critical legislation. Over the past 11 years, it has been a real pleasure and a labor of love to work with Chris on these issues, and he is truly a champion in the autism community. And I look forward to continuing that great working relationship with him. You know, Mr. Chairman, it seems that every time new data is released on autism spectrum disorders, the numbers become more and more troubling. In fact, the Center for Disease Control most recent data show a continued rise in autism prevalence rates. 1 in every 68 American children. That is 1 in 189 girls and 1 in 42 boys. These are staggering numbers with serious implications for many aspects of American life. This is why passage of the Autism Cares Act today is so important: to continue research into the causes of autism, to educate healthcare providers and the public, to improve early diagnosis and intervention, to identify effective treatments, and to evaluate the types of services available to young adults with ASD. We can and must do better for the millions of Americans living with ASD and their families. Many federal autism programs were first authorized by the Combating Autism Act of 2006, which has made a huge difference in the lives of autistic Americans and their families. Since its inception, Congress has reauthorized these federal autism programs twice. Without new legislation to reauthorize them, the funding for these important programs will expire on September 30th of this year. We have made tremendous advances in understanding autism spectrum disorders, but this progress will be lost if Congress allows these programs to expire. This is why it is so important that Congress pass this common sense, bipartisan, bicameral legislation like the bill that's before us today. The autism program this legislation would reauthorize are vitally important to many families and individuals across the country. Early diagnosis and intervention can make a huge difference in an autistic individual's life and can have a dramatic impact on the individual's family and community as well. With the prevalence of autism spectrum disorders much higher than we thought just a few years ago, inaction is simply not an option. I urge my colleagues to support the Autism Cares legislation. Thank you for the time. I yield back.
The gentleman from Pennsylvania is recognized.
Mr. Speaker, at this time I yield 1 minute to the distinguished gentleman from Florida, Mr. Bilirakis, a valued member of the Health Subcommittee.
The gentleman from Florida is recognized for 1 minute.
Thank you, Mr. Chairman. Thank you, Mr. Speaker. I rise today in support of H.R. 4631, the Autism Cares Act, of which I am an original co-sponsor. I want to commend our sponsor, Mr. Smith from New Jersey, and I understand a prime co-sponsor, Democrat, Mr. Mike Doyle from the great state of Pennsylvania, for sponsoring this bill. Autism is serious and does not discriminate. People in all racial, socioeconomic, and ethnic groups are impacted, Mr. Speaker. Autism awareness and research is something people from all walks of life can support. 1 in 68 children is diagnosed with autism. Let me say that again, 1 in 68. That is a disturbing statistic. This legislation will help direct autism research on a federal level. This research is vital, and I'm glad my colleagues and I have come together in a bipartisan manner to continue autism research, early identification, intervention, and education. I'm proud to support this legislation, and I urge my colleagues to pass this final passage of this legislation. Thank you, Mr. Speaker, and I thank the chairman and my colleagues for sponsoring the bill.
The gentleman from Texas is recognized.
Mr. Speaker, I yield to my good friend and desk mate on the Energy and Commerce Committee and ranking member of the Foreign Affairs Committee as much time as he can consume.
The gentleman is recognized.
Thank you, Mr. Speaker. I want to thank my good friend from Texas, Mr. Green, for giving me the time. I want to thank my good friend Chris Smith from New Jersey, whom I have so much respect for his hard work in doing this. And anyone who knows Chris knows when he wants something done, he's tenacious. He gets it done. And Mike Doyle also, who's been his really good partner. And we all take pride with this legislation. So I rise to support it. The Autism Collaboration, Accountability, Research, Education, and Support Act, or the Autism CARES Act. And I'm pleased that we have an opportunity to pass this today. Autism, as my colleagues have said, affects more than 2 million individuals and their families across our country. The rate of diagnosis has climbed dramatically in recent years, and today 1 out of every 68 American children is diagnosed with autism spectrum disorder by age of 8. That's really shocking. So these individuals and their families are counting on us to pass this bill. The Autism CARES Act will extend and strengthen the efforts we established under the Combating Autism Act of 2006 and the Combating Autism Reauthorization Act of 2011. I was proud to support both of these bills on the Foreign Affairs Committee and in the full House, and in the Foreign Affairs Committee and the Energy and Commerce Committee and the full House, and I am pleased to see that this legislation will give our autism programs the continued support they deserve. With this bill, we will extend federal autism programs for another 5 years, including vital autism research and prevalence monitoring, as well as training for medical professionals. This bill will also provide valuable updates to the law. It will increase coordination across federal agencies and improve our understanding of the issues youth and young adults face as they transition out of school-based services. These changes will advance our understanding of autism spectrum disorder and allow us to better assist the millions of Americans it impacts. The programs provided for in this bill have traditionally enjoyed strong bipartisan support on our committee. On the Energy and Commerce Committee, it enjoyed strong bipartisan support, and I guess it will as well here, because this is a strong bipartisan issue. So I urge my colleagues to continue this commitment by voting for the Autism CARES Act today, and I yield back the balance of my time.
The gentleman yields back. The gentleman from Pennsylvania is recognized.
Mr. Speaker, I yield 1 minute to the distinguished gentleman from Illinois, Mr. Peter Roskam, one of our distinguished leaders.
The gentleman from Illinois is recognized for 1 minute.
Thank you, Mr. Speaker. I thank the gentleman for yielding. 1 in 68 is diagnosed with autism, Mr. Speaker, and we have an opportunity to come alongside those families that are dealing with this diagnosis by supporting the Autism CARES Act. It is a holistic approach, one that takes on research, education, early detection, and intervention for those all across the autism spectrum. There's so many times that we can get into dollars and cents and chapter and verse and future savings and all of these things, but think about it. Beyond all of that is something that's much more important, and it's this. We can be a part of helping children reach their potential as adults. It is the desire of every parent to see their child reach full potential. So if we can do that by coming together with this legislation, think about the joy that is involved in that. I'm pleased to associate myself with the work of Congressman Smith and this effort, and to be a part and to be a co-sponsor of Autism Cares. I yield back.
The gentleman yields back. The gentleman from Texas is recognized.
Mr. Speaker, we have no other speakers, and I reserve my time.
The gentleman reserves his time. The gentleman from Pennsylvania is
speakers, so I
recognized.
reserve. We're ready to close.
Okay. I'll yield back the balance of my time.
The gentleman yields back the balance of his time. The gentleman
Mr.
from
Speaker,
Pennsylvania
I'm
is
very
recognized.
pleased to support this very important bipartisan legislation. Urge all the members to do so and yield back the balance of my time.
The gentleman has yielded back the balance of his time. The question is, will the House suspend the rules and pass the bill H.R. 4631 as amended? Those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended, the bill is passed, and without objection, the motion to reconsider is laid on the table.